Welcome to POCUS of the Week. We'll just jump straight into the case. This is an older woman coming in with some intermittent right upper quadrant pain. We're going to ultrasound her looking for gallstones. Here we have a long axis of her gallbladder, and of course, you see a few gallstones. But what else stands out in this image? Yeah, there is a whopping ginormous vessel underneath that. So next, to see if this is truly the IVC, we put the color box on it, and as you can see, it is just completely filling up with turbulent flow here. You see the same thing in the short axis here. So the next question is, where is this coming from? So we get a nice echo, starting with the peristernal long. You'll notice the squeeze is not bad, but that RV certainly looks a little bit bigger than it should. And when you turn it for a peristernal short, you'll notice that RV is certainly bigger than the LV. You see the same thing in the apical forechamber here. You'll also notice that that right atrium is huge. And if you look closely at the tricuspid valve here, you'll notice that the leaflets don't actually close during systole. There's a persistent gap between the valves. That is very suggestive of tricuspid regurgitation. To confirm this, I put color Doppler over that right atrium, and you can see there is a ton of regurgitant color flow going backwards from the right ventricle into the right atrium, kind of filling that whole thing up. The other thing you can do is you can put a pulse wave on it and actually look at the directionality and the velocity of flow. As you can see, there is a tiny little blip for forward flow and a ton of this backwards regurgitant flow. For comparison, I put the same flow of this patient's mitral valve. You'll see just a little bit of forward flow, and when the valves close, there's basically no motion or velocity at all. So, in conclusion, this is a case of some moderate to severe tricuspid regurgitation leading to a chronically dilated IVC. Thanks for watching.